Huh? Let's say there is any deficiency for vitamin or minerals, the performance drops. Vücudun taktığından emin olalım mı? Ha? Kulaklık mı getirdin? Evet, tamam. Sen buraya kulaklık getince bana çağırıyor, o zaman başla. Siz başlayın, diğer kişiler de şey yapacaklar. Başka dinleyecekler mi? Ben devam edin diyorlar. Tamam. For example, anabolic steroids, male hormone, and similar things. Once we use these materials, we see an increase in the mass and the power of the muscle. This is what we know in the medical terms, or the growth hormone, or some peptides. We're going to talk about them now. So, even in low doses, presence of this substance is going to be the violation of the doping regulations. So, the second point is that it creates a significant or potential health risk. Not every substance creates a health risk for everyone, but we're talking about a potential based on genetic traits. For example, let's say there is the risk of creation of the testicle cancer, and this is a potential. Anabolic steroids have this potential as well. So once we remove the equal condition, we basically eliminate the spirit of the sport. So it's something like men and women competing in the same contest, or in a wrestling match. So if two of them are present in any method or substance, they could be listed as well. The list committee, every year, they have 3 meetings, one in January, the other in April, and the other one in July. And they decide the list of the next year because the medicine moves forward and different substances show up. Pharmaceutical sector is developing as well, and new substances could be created. So they evaluate whether the new substances have the 2 of the 3 of the things that I mentioned. So there's a consultancy mechanism as well. In May, they send a draft list to every country and their federations, and every stakeholder presents their opinion on this issue, and in August it is clarified and it is approved in ULUDAÐ's executive board meeting in September, and in October 1st it is published, and on January 1st it is commissioned. So we have a Turkish anti-doping commission as well. 2026 list has been declared as well, by the way. On the website of this commission, there is the mevzuat, that is to say the regulations tab, and when you click on prohibited substances, you can see the past changes as well. So the prohibitions list, which groups are present in those lists, as you're going to be medical doctors It is important that you know them, especially for the athletes not to be the victims of this regulation. There is a huge benefit that you know that. So at Ankara University, we provide this training for 15 years. This prohibited materials list has three main groups. In the first one, there are substances that should never be used. It is, it is prohibited all the time, not only during the match or contest, but outside as well. And it has 6 subgroups. And we have the methods that are prohibited all the time, and it has 3 subgroups. And some of them are prohibited during the game, during the match only. But outside the match, they could be used for treatment purposes, for example. So how are we going to differentiate between, the contest and the rest? So let's say it starts at 23:51, like by the midnight, basically. The third main group is prohibited only for some sports. Let me try and summarize them. How much time do I have left, Dr. Akova? I can talk for 3 hours, The speaker must use microphone to be translated. 15 minutes, okay. All right. In the first subgroup, we have unapproved substances. These are materials that have not been approved yet for human use. So these are basically the materials that include 2 out of 3 things that I mentioned. They could be used for veterinary purposes, but they're not used for humans. I mean, they didn't pass phase 3 studies, basically, but they could be performance enhancing. So in the sports, the most abused substances are anabolic androgenic steroids, AAS, and they have been present in 1950s. It is very effective, by the way. But it could create serious health issues. It is effective almost on all the organ systems, especially in the cardiovascular systems. They create serious issues because it has an effect to increase the muscle mass, and it increases the mass of the heart muscle as well, but it creates heart deficiency. It is mostly used in sports that require power and speed, like weightlifting, for example, or jump-related sports in the athletic competition. For them to be effective, they should be used way above the treatment dose so that the muscle mass increases. So consider that these substances could have side effect even in low doses. So consider their influence when you use it in a high dose. And we have Anabolic but non-androgenic substances. Clenbuterol is a popular one. It's mostly used to treat asthma, and it is used for animals mostly, like horses, cows. But there's another usage for that as well. In husbandry, big animals, muscle carcass is also enhanced by that. Clenbuterol in some countries is not prohibited in husbandry in China, Guatemala, Belize, Mexico. In husbandry, you can find clenbuterol in the meat. So if an athlete visits those countries and eats meat in these countries, so it is found in their body, so they could be victimized. In most cases, weightlifters use this material. So now the third subgroup, in this one we have peptide hormones. Erythropoiesis enhancing materials. This is basically blood creation substances. And which sports would require blood? Like endurance sports, right? Like the sprints after 800 meters, for example, swimming after 100 meters, cycling, skiing. In these sports, it's important that oxygen is transported to the muscles to increase hemoglobin. And for this reason, these substances are abused. So, erythropoietin receptor agonist is an example to that. We have HIF activating agents. I'm not going to go into details. After the third term, you would understand what HIF is, right? What is HIF? Okay, who's first grader here? Second grader? Third? Fourth? Even less? Fifth? There's no one. We wouldn't have interns anyway. So, gata inhibitors. And there are different materials. They increase hemoglobin. You know what hemoglobin is, right? You do, right? Okay. All right. In the first period, I don't know what hemoglobin is. Maybe you want to explain. I'll explain for you later, but if you buy me a meal. Another hormone is the growth hormone. They have a muscle mass increasing, enhancing effect. Are they more effective than anabolic steroids? No, they are more effective, but the growth hormone is more difficult to find in them. This is why they start with anabolic steroids, and then in the competition period, they move on with that. They have serious side effects. I'm not going to go over them one by one. I'm going to be coming next year if you put this organization together again. They've just given 20 minutes. Come on. So this is an insulin-like growth factor. Athletes basically could abuse this substance rather than the growth hormone. Different substances could be used to increase the muscle mass. Beta-2 agonists. So this is an important medicine that we use for asthma treatment. With glucocorticoids, we use them. In high doses, they increase the muscle mass and burn the fat. This is why it is being abused. They're not using it to basically enhance the respiration, but the athlete could use some of them, salbutamol, salmeterol, vilanterol, and formoterol could be used if there's asthma. But you could also see them on the prohibited list. Group 4, Hormone antagonists and modulators. In this group, we have different substances, especially there's an enzyme that turns testosterone into estrogen, aromatase. If there is excessive testosterone in the fat tissue, the body turns it into estrogen. This is used to prevent that. So testosterone stays higher in the body. This is why they abuse the substance. And this is another similar one. There is another substance here that increase the impact of the growth factor. Insulin is used, for example, and they're mimetics. We have meldonium and trimetazidine. Rıza Kayal had trimetazidine in his body, especially if there is dizziness, for example, it is used, but it is prohibited because it increases the cardiac performance. So the athlete should not use this substance. If he has to use, there are some procedures. I'm going to expand on them. So we have diuretics and masking substances. They're used for two purposes by the athletes. One of them increase the amount of the urine, and during the doping control, they basically change the integrity of the urine. That is to decrease the concentration of the prohibited material. And in most cases, it is used to lose weight in categories like wrestling, boxing, weightlifting, judo. You know, the groups are determined by the body weight of the athlete here. And once the athlete uses this, they basically lose the body weight. This is why it is prohibited. Do they increase the performance? No. So I said at the beginning, 2 out of the 3 criteria. They don't have a performance enhancing effect, but they have serious side effects. All right, I'm moving on fast here. And here we have the methods. The first one here is the usage of blood and blood products. In the endurance sports, you know, the red spheres and hemoglobin is increased by transfusion. And since 1970s, it is used in the sports activities. It was prohibited in 1980. Before 80, it was not prohibited because in most cases, autologous activity was being done. The blood of the athlete's own blood was given back in the time, but since 1980, it is also prohibited. The objective here is to increase the oxygen in blood. It affects like erythropoietin. So, autolog, allogenic, and heterolog blood transfusion, they are called blood doping. Chemical and physical response. During the doping control, you know, to change the integrity of the sample, they sometimes use somebody else's urine and they change the urine or they change its purity. They use, for example, protease, 1 gram of protease, and all the existing protein in the urine it disappears when you use them. So analysis becomes difficult. So such chemical and physical responses, interventions are prohibited as well. Gene and cell doping, we have no analysis for that, but it is prohibited. It is prohibited to have some genetic practices. So which substances are prohibited during the competition? Well, stimulants is the first group. They're being abused since the ancient ages. In most cases, they basically stimulate the central nervous system, and they have the potential to increase the performance. Amphetamines, ephedrine, pseudoephedrines, methylephedrines. Coca leaves is used, for example. In this group, the substances are mostly used to increase concentration and awakeness, and they basically um, decrease the reaction time, and they help the athletes get rid of weariness. Sometimes some of them are used anti-flu medicine as well. Ephedrine is used, for example. A lot of athletes are banned because of that. We have more than 60 stimulants, by the way. So there could be, some athletes could use them for health purposes, for treatment purposes. We have methamphetamine as well, by the way. Or sometimes it is used on purpose, that is deliberate use. Cocaine, methamphetamine, these are most frequently used by the athletes. If you download the prohibited list, you will see them. Methylhexanamine, unfortunately, it is contaminating the supplements of nutrition. That was a beautiful question, remember? For the supplements, I'm going to give you information on that, by the way. Methylhexanamine could contaminate these supplements. Sibutramine could also contaminate them. The athlete is basically, the athlete thinks that he's using weight loss material, but there is supplement in them. So once there is sibutramine, the athletes are prohibited. Narcotic analgesics, morphine and similar ones, by the way. So they increase the pain threshold, especially in competitive sports like boxing. For example, when an athlete sustains a hit, he doesn't feel the pain, but it has a lot of side effects, so it is prohibited as well. There is tramadol, recently added. It's also known as contramal, and it is being used by the athletes recently. It decreases pain and it suppresses the feeling of weariness. This is why it is being used by the athletes. Cannabinoids, like cannabis and similar ones, they're also prohibited. Glucocorticoids, cortisone, cortisol, there could be orally taken or intravenous or intramuscular, or they could be rectally implemented as well. Sometimes they are used as a drop in the nose, or they could be inhaled through respiration, especially it's used for asthma treatment medicine. So every injectable form is prohibited, by the way. The others are allowed, they're permitted. There could be intravenous, intramuscular, periarticular, intraarticular. They're all prohibited. So you see the permitted use, dermatologic, nasal, and ophthalmic use is permitted. The last group, the third main group, by the way, we have beta blockers. They decrease the heart rate. In certain sports, they prevent handshaking, they suppress the excitement and increase the performance. But in other sports, if they use, they could be basically dropping the performance. Archery, for example, or underwater sports, they're prohibited even outside the competition. In other sports, they are prohibited only during the competition because they increase the performance much more significantly in these sports. In a fast manner, let's talk about the violation of law. I think I have 10 minutes left. 5. Let's skip this part then. Doping controls. So, how about the treatment purposes? Use. If an athlete has to use one or more of these substances, they should get permission. Let's say the athlete has diabetes and has to use insulin, or testicular deficiency there is, and the athlete has to use testosterone, or there is retarded growth and then the athlete has to use growth hormone. So you cannot basically say drop these sports if you want to use. So there is a category of their usage for treatment purposes. We have 4 important benchmarks here. If the cutoff of the use harms the health of the athlete. The second group is the dose should not have a performance enhancing effect. I mean, we're talking about low doses here. And they should not have a reasonable alternative treatment, replacement treatment. You can't replace anything for insulin or growth hormone or testosterone, for example. And the last point here is that high-dose anabolic steroids or testosterones could be about testicular deficiency, or they create atrophy. If the athlete has done that before and if he wants to use it again, we say no, you cannot use it. But the athlete has used growth hormone and it triggered diabetes mellitus, and for that reason he has to use insulin. So this is the last article. Is it only the athletes that use doping? No. We call if the athletes do it doping, the others basically use performance enhancing drugs. So PED in abbreviation. So why do people use it? Because they're very accessible. In many stores we would see proteins, vitamins, minerals. Who used protein powder or any other supplement, including vitamin and minerals? Who uses them? Hence. Thank you. Do you know what you use? I was always suspicious about that. At Ankara University Legal Sciences Institute, we are running a study now in big e-commerce platforms like Hepsi Burada and Trendyol. We checked the cheapest materials and we found materials other than those disclosed on the tag. We found ibuprofen, for example. We found paracetamol, estradiol we found, and it's not disclosed on the tag. It doesn't say caffeine on the tag, but we found a lot of. We found resveratrol, a lot of it, by the way, but it doesn't disclose it on the tag. Yohimbine we found. Why ibuprofen? Why paracetamol? Because once people use them, they feel relaxed. Why estradiol? They say they're not getting anabolic steroids, they're getting protein, but you know, your breast, if for a male user, it grows your breasts, for example. Don't use them. What can you use? You know, you can use certified substances. I'm telling the producing companies, maybe some of them are present here, please do get certification for what you produce. And you should basically disclose what you use as ingredient, and you should basically declare that there is no prohibited material used in this matter. So basically maintain your own regular nutrition. Don't waste your money on these supplements. So once we increase the level of our studies, we're going to obtain the right to give certificate. The second reason is that they are very effective because they add some other material substances. You know, they could have anabolic steroids, for example, especially mass gainers and whey proteins. People want to be somebody else, and they would like to delay the sleep and increase the awakeness. So especially students are using methylphenidate, for example. Methylphenidate is broadly used by students. It doesn't work for anyone except for those hyperactivity and attention deficit disorder. So they are used to decrease the appetite sometimes, and they want to change how their body looks. If I exceeded my time, I'd like to apologize. There is a website, and we have a training program as well. This is on the screen now, tdmk.org.tr, the official webpage of Anti-Doping Institution. You can go on to Clean Sports training platform, and we have two training platforms here. Clean Sports for everyone and Clean Sports for health professionals. Please do complete both tests. They're going to be very useful. Thank you very much for listening. Thank you. Thank you, Professor. You owe me a kebab now. Thank you very much, Professor Rüştü, for the detailed presentation. I have refreshed my knowledge as well. So it was good for me as well. Do we have any question from the room on that subject? Like tough one. Not very tough. You said you have conducted a study. Does it include 10 gram vitamins? No, I get magnesium, for example. You know, the medicine that you get from the pharmacy, they are mostly audited by the Ministry of Health. If it is just being audited by the Ministry of Agriculture, the Ministry of Agriculture basically does not run an analysis Ministry of Agriculture just checks the ingredients. They don't have a system to run a test. I mean, they have a lot to cover on their table anyway. They need to check the amount of methyl alcohol on the alcoholic products or pesticides in the tomatoes. They have a lot to work on, so they can't focus on that. And here's what we say: this is a significant problem. Maybe we should bring the ministries of health and agriculture and create a system for that. This system victimizes the athletes, and there are also, I mean, the broad public could also have health issues if they use these materials. We are basically working on a legislation regarding the anti-doping activities. After that, we're gonna do a study on supplements. There are good examples. Australia sets a good example. Canada, another one. Germany. We're gonna try and bring similar examples to Turkey. So those who are sold as medicine, they're being audited. They're being checked in 8 stages. Thank you. And you said certified seller. What's the difference between buying from the certified seller or pharmacy? Well, in the certified seller, let's say 2 products could come in different batches. This one came 2 days ago, this one came today, for example. Every batch, I mean, there are analyses labs, 6, 7 of them in the world. For every batch, they run an analysis. Let's say in this batch, there is no problem. They run a study on prohibited substances as well. In the UK, Germany, and US, these labs give the certification, and the companies basically publish them on their websites, declaring that there is no prohibited substance used in this batch. We don't have a system like that in Turkey yet. Hardline is our sponsor, right? So maybe they can send it overseas and get them tested. One company does it, I know. From Cologne, they get approval. I'm not gonna disclose the name. All right, thank you. There could be others as well. Yannick Sinner was #1 in tennis, and because of doping, he was prohibited for 3 months. So normally he should be prohibited for 4 years for that substance. If you listen to the athlete, for example, in his own defense, if there is a reasonable argument, the anti-doping institution could basically decrease the punishment, the fine. Here's Sinner's situation. You know, let's say the physiotherapist of the athlete has a wound in his hand and then does a massage on the athlete with his hand, and with the massage oil, it basically is taken in by the body of the athlete. Picogram amounts, I'm talking. If there's a picogram, there should be a time that it was basically nanogram, because it decreases in time, right? So as athletes join in the activities on a regular basis, they have given samples. I mean, if the amount found is in line with the argument of the athlete in his defense, it could be basically in favor of the athlete. Not everybody knows that, and this is why people basically blame Yannick Sinner. I mean, is it reasonable? It is. And there's also Valieva case, Kamila Valieva, in Beijing Games. In ice skating, trimetazidine was found. The same substance found in the body of Rıza Kayal. He was, she was prohibited for 4 years, and Rıza Kayal was banned for 1.5 years. Rıza Kayal basically said that I have used, but I used it for dizziness treatment. So this is basically in the discretion of the anti-doping committee. Normally, Rıza Kayal, the Turkish athlete, should be banned for 4 years. Kamila Valieva is a 14-year-old kid, but she couldn't prove how she got it. Rıza Kayal used it on purpose as a medicine he shouldn't have used, actually, because we're talking about an experienced athlete. I know him in person, by the way. All right, thank you. If no other question, then thank you very much, and I greet you with respect. Thank you. Petra, it's time to play. All right? So, the organization committee, what do you say about giving a break now? 10 minutes break now. All right, we have 10 minutes break. We will be back in here after 10 minutes. By the way, plaque is going to be given to Dr. Rüştü. Please stay on the stage. Distinguished professors, thank you very much for this rather informative session, and I'd like to invite Melike Beyza Çınar to give the plaque.
Ses. Şu an açık. Tamam. Teşekkür ederim. Aynen. Ses. Oyuna gidiyor. Herkese merhabalar. Profesör Becettin Akova'ya teşekkürler. Yaren ve organizasyona teşekkürler. Gerçekten iyi bir iş yapıyorsunuz. Bu organizasyonu yapan kişileri düşündüğümüzde bunun arkasında ne kadar çok iş olduğunu söylemek de mümkün. Burada olmaktan çok büyük mutluluk duyuyorum. Size tekrar tebrik ediyorum. Değerli arkadaşım Metin'e daveti için de teşekkürler. Yani arkadaşlarımız biraz soru işaretiyle dolu çünkü bana zor bir konu hakkında konuşma yapmamı istedi. Burada aslında önemli bir bulgu yok, bilimsel bir bulgu yok ve bizim spor dünyamız sizleri burada klinik pratikler üzerinde biraz uzman görüşleri ve hipotezler üzerinde bilgilendirme amacıyla buradayım. Burada sporcularda süren antrenman ve yorgunlukla alakalı olarak konuşma yapmak istiyorum. Başımı biraz değiştirdim çünkü slaytlarımı organize ediyordum. Bunu nasıl doğru yapacağımdan da emin değildim. Şöyle başlamak istiyorum. Ne kadar spor yapmak doğrudur? Ne kadarı azdır, ne kadarı çok fazladır? Bu soruya cevap vermeye çalışacağım. Yani nasıl cevap vereceğimden emin olmasam da çalışacağım. Burada egzersiz paradoksu var. Düzenli fiziksel aktivitede tek bir burada doğrudan bilimsel olarak gördüğümüz bir bilimsel bulgu yok. Ve burada farklı kardiyovasküler hastalıklar, örneğin diyabet tip 1, 2 ve kanser süreçlerinde, Alzheimer hastalığında bunun ilerleyişini durduran, farklı kronik hastalıkları da yavaşlatan süreçlerden bahsedebiliyoruz. Burada her şey zehirdir ve zehir olmayan hiçbir şey yoktur. Sadece zehir olup olmadığını bir şeyin dozu belirler şeklinde bir düşüncemiz bulunuyor. Burada bazı egzersizin işlemini artırmak farklı patolojik sonuçları meydana getirebiliyor. Aslında bu bizim merak ettiğimiz bir soru. Burada birçok çalışma var bu konu hakkında. Çok yakın sonuçlar elde edildi. Burada farklı J eğilimi ve U eğilimi konseptleri üzerinde iki farklı görüş var ve burada riskler üzerinde de konuşabiliyoruz. Örneğin burada eğimin yüksek morbidite ve mortalite riski olduğunu söyleyebiliyoruz. Burada yüksek egzersiz faaliyetlerinin yapılması, bunun sıklığının artması ve tipinin artması ile bazı daha farklı düşük riskler de oluşturabilmekte. Peki sizce daha ekstrem fiziki aktivitelerden bahsettiğimiz zaman ters bir J eğimi meydana geliyor ve burada aslında daha ortalama bir risk meydana gelmekte. Biraz sedenter olmaktan daha az meydana geldiğini söyleyebiliriz risklerin. Burada odaklanmaya çalıştığımız şey farklı vücudumuzdaki organik sistemlerde farklı bölgelerle alakalı bir şey. Örneğin kardiyovasküler sistemde akut akut efektlerle meydana gelebiliyor. Burada masküloskeletal sistemlerde örneğin fazla travma meydana gelmesi veya kronik ağrı meydana gelmesine de yol açabilir. Bir kardiyolog bakış açısıyla değerlendirmek gerekirse burada optimal doz fiziki aktivitenin belirlenmesinde 1000 met dakika hafta olarak hesaplanmaktadır. Ve 1000 kilokalori üzerinden ortalama olarak hesaplanmakta. Bu 2,5 saatlik ortalama bir fiziki aktiviteden ya da 75 dakikalık zorlu bir egzersize eşit. Bu optimal doz kardiyovasküler rahatsızlıkların ortaya çıkma ihtimalini %20-30 arasında azaltmakta. Burada J eğiminden, hipotezinden bahsedersek, burada farklı, burada Platon'un yüksek volümlerinden bahsedersek eğer, burada örneğin bir maratondan daha fazla koşu yapmış kişileri düşündüğümüzde bu kişilerin kalp krizi geçirme riski bunu normal egzersiz yapanlara göre farklı olduğunu söyleyebiliriz. Ancak bazı yazarlar bunu tartışıyor tabii. Burada kardiyovasküler hastalık, mortalitenin fazla yüksek seviyelerde olması, örneğin 4000 met dakikaya hafta olarak hesaplandığında, burada maratoncuların olaylardan yüksek derecede etkilenmesi 10 kat fazla olarak meydana gelmekte. Burada hangi parametrelerle ölçüm yapıldığını aslında görmeye çalışıyoruz. Burada hangi egzersizin hangi parametrelerle hesaplandığını düşünüyoruz. Burada kural şu: fiziki aktiviteden sonra bir troponin ve BNP seviyelerinde bir değişim meydana gelmekte. Bunlar muhtemelen fizyolojik membran açığı oluşmasından dolayı meydana geliyor sanıyoruz. Nekroz olması değil. RV disfonksiyonunu yapısal olarak değerlendirdiğimizde burada bazı yama gibi yapıların oluşması ve aritmiye maruziyetle alakalı bir değişim görüyoruz. Atriyal fibrilasyonda 5 katlı bir risk faktörü görünüyor. Burada inflamasyon ve atriyal dilasyon gözükmekte. Ama çok ekstrem spor yapan atletler genç ölürler mi? Burada ilk gördüğünüz cümleye bakmamız gerekiyor. Burada açık cevabımız hayır. Çünkü örneğin Fransa turundaki bisikletçiler normal popülasyondan 8 yıl daha uzun süre yaşıyorlar. Ve burada fazla spor aktivitelerini değerlendirdiğimizde Fransa'daki zorluk yarışta fark olduğunu da belirtebiliyoruz. Burada mortality'yi de etkiliyor. Burada iki paradoks. Burada kireçlenmiş uzunlarla alakalı daha bir açıklaması oluyor. Burada ortopedistlerin görüşünü burada düşünmeye çalışıyoruz. Örneğin bu sporlarda tipik bir koşu sporunu ele alalım. Koşu sakatlanmalarında epidemiyoloji. Burada bunun yükü aslında yüksek görülmesine sebep olması. Örneğin sporcuların yıllık olarak %20'si sakatlanıyor veya bunların çoğu kronik rahatsızlığa maruz kalabiliyor. Çünkü burada kronik bir maruziyet söz konusu. Burada ayak bileğinde, ayakta ve kalça tarafında bazı lokal sıkıntılar çıktığını görebiliyoruz. Aynı zamanda MTSS ve plantar sendromunda tipik sıkıntılar olduğunu söyleyebiliriz. Farkındayız ki burada bazı risk faktörleri var ve bunları önceden de tespit edebiliyoruz bu travma ya da sıkıntı olmadan. Bazıları örneğin varüs, dizde varüs veya ayaktaki uzunluk, kas uzunluğuyla alakalı olarak bazı bizim bilemediğimiz anatomik yapılar burada çalışmayı da ekleyebiliyor ve kaç kilometre koşulduğu aslında. Yani hem içsel hem de dışsal faktörler görünüyor. Örneğin bir kişinin 65 kilometre, haftada 65 kilometreden fazla koştuğu durumlarda burada fiziki hasar olayı hızla artmaya başlıyor. Burada bir kural var bizim önemsememiz gereken. Bunu aktivitelerimizi %10 artırma kuralı. Burada aşamalı bir artıştan bahsedebiliriz ve sonra kalan günlerde de dinlenme payı bırakılmalı. Peki üçüncü organik sistemimiz nedir? İmmün sistemimiz. Burada bir açık pencere bulunuyor. Bu çok daha ortalama aktivitede immün gözleminde biraz artış meydana geliyor. Örneğin bu %40, %50 oranında gelişebiliyor. Daha böyle yüksek seviye atletlerde çok önemli bir olaydan önce örneğin mesela bir olimpiyat olabilir, bir şampiyonluk mücadelesi olabilir. Burada bunlara yaşadıklarını daha fazla akut respiratory enfeksiyonları görebildiklerini görüyoruz. Bu neden? Çünkü burada immün baskılama konusunda gördüğümüz şey bir EHA nükleerinin ve NK hücrelerinin değişimiyle alakalı bir durum ortaya çıkmaktadır. Ve burada enfeksiyonlara açık hale gelmektedir. Ve bu 6 kat daha fazla maruziyet ve sakatlanmaya maruziyet meydana getirmekte. Sonuç olarak burada sınır nedir? Yani sorumuza cevap verirken ne kadar spor doğrudur, ne kadar spor yapmak yeterlidir ya da ne kadar azdır, ne kadar çoktur? Burada kardiyologlara göre kardiyovasküler sistemi ele aldığımızda çok fazlalık çok az görülen bir şeydir. Çünkü sporun yararları ekstrem risklere karşı zaten sizi korumaktadır. Burada EF ve benzeri kondisyonlara doğru açık olmaktan kaçınmak gerek. Ve buradaki bazı kondisyonları da kaçırmak elde değil. Ortopedistlere göre çok fazla spor evet sıktır, sık görülmektedir. Örneğin 65 kilometre koşu ve üzeri haftada olmak üzere. Masküler iskelet sistemin kalpten daha örneğin acıya daha fazla katlanabiliyor ama bu sizlerin tamam diyebileceğiniz bir şey değil. Çünkü buradaki ağrıyı dinlemek zorundasınız. Ben hep şöyle söylüyorum. Eğer spor yapıyorsanız biraz ağrının olması gerektiği düşüncesi yanlış. Ağrınız olduğu zaman atletler yani nasıl söyleyeyim? Burada optimal olarak sizin buna sağlığınıza hazır olmanız gerekmekte. Yoksa bazı